Good morning, everyone. My name is Gailen Marshall. I'm from the University of Mississippi Medical Center. I'm the new chair of the Chronic Fatigue Syndrome Advisory Committee. It's my pleasure to welcome you here on behalf of my colleagues. And we have a very full agenda for the next 2 days. We're going to start out with what I think is the best part of the agenda, some comments from our benefactor, our champion, Dr. Howard Koh, who's the Assistant Secretary for Health. And as you will find out, if you have not had the privilege of hearing him before or speaking with him, you'll never find a stronger advocate for this illness than Dr. Koh. So, please.
Dr. Marshall, thank you so much for that kind introduction, and thank you also for stepping up and now serving as our new chair for this very important advisory committee. I know that you have been a member here and also have a lifetime commitment to doing research on this disease and caring for patients with CFS. In fact, just to brag about Dr. Marshall for a minute, he's professor of medicine and pediatrics at the University of Mississippi Medical Center. He spent approximately 16 years providing care for patients with CFS. He's published numerous peer-reviewed articles and book chapters on a range of topics in allergy, immunology, and infectious disease. And he also currently serves as editor-in-chief of the Annals of Allergy, Asthma, and Immunology. So he's an outstanding colleague, an outstanding professor and researcher, and we're absolutely delighted that he's our new chairman. So a round of applause for Dr. Marshall. And it's always my pleasure to come to this advisory committee because we have such important work to do. This is such a critical area for public health. There are many patients suffering from this condition, and we need to do as much as possible to coordinate research, education, patient care, and try to improve quality of life for those who are affected by this condition around this country. So we are looking for this advisory committee to continue to do that work, and we are very, very grateful to the committee members who are here, who are giving us of your time to make a difference for public health. Before I go any further, can we just go around the room and do some intros so everybody knows who each other is? Dr. Lee, do you want to start?
Sure. And I think we need to press our buttons here when you speak, because we have, just for, if people don't know, we are audio, we have a call-in number that people can call in and listen on the phone. We're also live streaming this meeting, so we always need to speak into this mic. So don't forget to hit the little button. And so I'm Nancy Lee. I am the Deputy Assistant Secretary for Women's Health here in the Office of the Assistant Secretary of Health. Dr. Koh is my boss, and I'm also the designated federal official for this committee.
Good morning. I'm Marty Bond, Senior Public Health Advisor and an alternate DFO. Glad to be here.
Good morning. My name is Susan Meyer, and I'm here from the National Institutes of Health.
Good morning. I'm Amanda Wolf, and I'm here with the Social Security Administration today.
Elaine Perry with the Centers for Medicare and Medicaid Services.
Dane Cook, Associate Professor, Kinesiology, University of Wisconsin-Madison.
Susan Levine, private practice, New York City.
Dr. Ann Vincent from General Internal Medicine, Mayo Clinic.
Dr. Jacqueline Rose, patient sufferer.
Steve Krafchick, attorney in Seattle, represents people with chronic fatigue syndrome.
I'm Adrian Casillas, Associate Professor in the Section of Allergy and Immunology at Louisiana State University Health Sciences in Shreveport.
I'm Mary Ann Fletcher. I'm Professor of Microbiology, Immunology, Medicine, and Psychology at the University of Miami in Miami, Florida.
Jordan Dimitruk of Boston, Massachusetts.
Eileen Holderman, patient rep. Thanks, Jordan.
Good morning. I'm Beth Collins-Sharp from the Agency for Healthcare Research and Quality.
Hello, I'm Terry Michelle, representing FDA. Good morning. I'm Ermias Balai, and I'm from the Centers for Disease Control and Prevention.
Okay, thank you, and welcome everyone again. And let me start also by thanking our tremendous colleagues at the Office of Women's Health, Dr. Nancy Lee and Marty Bond. Dr. Lee is still a relatively new director of our Women's Health Office, and in her opening year here, she has spent a tremendous amount of time on this area and this advisory committee. And one issue that came up immediately was how to make sure that the community around the country who is committed to these issues had access to the information going on here and the discussion, the valuable discussion that goes on here at every meeting. We wanted to do that in a way that was open and transparent and brought in as many people as possible. And then in these difficult budget times, we wanted to do this in a way that had the lowest cost possible. And after much exploration, Dr. Lee and Ms. Bond discovered this live video broadcast team. We feel like we're doing this committee in a TV studio today. We have, I think, 3 cameras here. But this is the Secretary's Communications team, and they're bringing you this advisory committee proceedings live around the country. So we're very, very grateful to you, Nancy, and to you, Marty, for making that happen. And a round of applause for the two of them for doing this. Thank you. So that alone is an achievement, and we're very, very grateful to that, and we want to continue the conversation with all of you. And then before we go further in the remarks, I want to welcome not only the new chair, Dr. Marshall, but 3 new members. And we're delighted at the caliber of our members because we tried to bring in the highest level colleagues to make a difference on this committee. So you heard that Dr. Adrian Casillas is Program Director, Allergy and Immunology Section, Louisiana State University Health Sciences Center, Shreveport, Louisiana. We're delighted to have him here. We also have, as you heard, Dr. Jacqueline Rose, and she is a full-time staff board-certified anesthesiologist at the VA Medical Center in Washington, D.C. She's also a member of the CFIDS Association, has an extended interest in public health, and is a person who suffers with myalgic encephalopathy. And then our third new member is Dr. Marianne Fletcher, who's director of the E.N. Papper Laboratory of Clinical Immunology, the University of Miami Miller School of Medicine in Miami, Florida. She, too, has participated in research projects in CFS, as well as vital areas such as HIV, AIDS, and Gulf War illness. So we continue to have an outstanding advisory committee, and we want to thank the new and the returning members. I wonder if at this moment the new members can step forward, and I have the honor of swearing you in. And we're going to be capturing this for posterity with Kathy coming up with her camera. So can the new members step forward and we'll swear you in? So a round of applause again for our new members. We always love doing that. Okay, let me just make some comments about what's happened since the last meeting and the progress we continue to promote in this very important and very challenging area. First of all, you know that this advisory committee has a number of subcommittees that are addressing integration of efforts on research, education, improving quality of life. And so since the last meeting, I understand the subcommittee on research has contributed to a very important published article entitled Minimum Data Elements for Research Reports on CFS. We're trying to integrate research efforts and make them more whole, if you will, and make them more uniform for researchers who are trying to advance efforts in this very vital area. So this article on minimum data elements will help us reach that goal. And then also since the last committee gathering, the Subcommittee on Patient Education and Quality of Life has helped to identify the topic for today's discussion, that is on childhood CFS. So I want to thank that subcommittee for identifying that critical area and bringing some key speakers here today to discuss this area. That same subcommittee is also working closely with CDC, the Centers for Disease Control and Prevention, on the content of the CDC's Chronic Fatigue Syndrome website. So we want to thank the subcommittees for pushing those efforts forward and also for continuing to prioritize the recommendations that are coming out of this advisory committee. Let me also tell you what's happening at the department, because we understand that we need to integrate and mobilize efforts in this area better than before. I did mention at the last meeting that about a year ago, we and the Secretary convened a cross-department meeting on chronic fatigue syndrome to consider how the department could best address the needs of patients and the community around the country. We all agreed that we needed to improve communication within the department and collaboration within the department on this area. So an ad hoc work group has been established and has met twice and will continue to meet. And I really want to thank again Dr. Nancy Lee, who has chaired these efforts. Getting all these leaders of the department to come to the same table and establish a common agenda is never easy, but these two meetings have been productive, and we're going to have more until we have more deliverables to present to you. Just to stress that these are agencies that include NIH, CDC, the Agency for Healthcare Research and Quality, AHRQ, Health Resources and Services Administration, HRSA, the Substance Abuse and Mental Health Services Administration, SAMHSA, the Centers for Medicare and Medicaid Services, CMS, FDA, and also the Administration on Children and Families, ACF. As the Assistant Secretary, I have the honor of seeing the broad departmental perspective on this area and many other public health areas, and I know we make advances when the whole department is working together as one. So that's what this ad hoc work group is trying to do on the CFS area. At these two key meetings under Dr. Lee's leadership, we asked each agency to put forward accomplishments and opportunities for the future that would begin new efforts and conversations, identify new activities, and try to do the best we can in a very difficult funding environment. And let me just share some of the highlights of what have come forward in the two meetings that Dr. Lee has chaired. First, we continue to have a lot of attention on the National Institutes of Health, NIH. They have a special emphasis panel dealing with CFS that's been established, and this panel regularly reviews submitted applications for CFS research. So that is very important with respect to coordinating attention to all the submitted applications to that critical research agency. The CDC has also made available clinical assessment data for all their researchers involved in this area and put that forward in their research data center. So that's another step forward with respect to integration and transparency on data discovery, if you will, in this key area. The CDC is also promoting provider education and finalizing and receiving accreditation for 2 CME courses, continuing medical education courses, on CFS that are now available to clinicians via the internet. We know that provider education continues to be a very, very important area to reduce stigma and increase understanding. So that effort by the CDC, we believe, is a contribution. We have an FDA colleague here who can tell us more, but the FDA has developed in-house expertise in this area by educating its medical product reviewers and centralizing the review of applications from medical product developers seeking approval for CFS treatments. So again, raising awareness and education at the highest levels of the FDA. And then back to the CDC, it's completed its first round of updates to its website, and it's incorporating, very importantly, the feedback that we've heard from advocates in making those changes. So we want that dialogue to continue here, and we're very committed to making that partnership go forward. And then altogether as a department, in these conversations, there have been preliminary ideas put forward about possibly having a national webinar on CFS and also potentially establishing a patient registry. So those conversations keep going. We know that everybody is interested in cutting-edge research in this critical area, and I'm sure that everybody knows that there's a critical study that is being finalized now, led by Columbia University investigators. The results of that study are being finalized as we speak. One very valuable outcome of that effort is that an important and unprecedented repository of blood samples has been collected by Dr. Ian Lipkin and his co-investigators. These are samples from individuals with well-characterized disease, and in my discussions with NIH and the top leaders there, they stress that having this new repository of blood samples will be of great value for future potential studies. So we are awaiting the results of that study soon and hope to share that with you in the very near future. And then we have accomplishments from Dr. Lee's Office on Women's Health. She has posted listservs on the CFSAC website related to OWH, and hopefully the information on that website will help subscribers receive information about upcoming meetings, call attention to this live web streaming capacity that we've just announced, and also share other cutting-edge information as it goes forward. So please take a few minutes to join by going onto that website, and you can find out more details about it from flyers that are being distributed at this meeting today. And then I'm very, very pleased that under Dr. Lee's leadership, we want to improve communication with ME/CFS organizations around the country. As you can see from the agenda of this advisory committee meeting, a number of those organizations have been invited today to give presentations here, and we want to improve dialogue with and representation on this advisory committee of a number of these organizations, and that's a process that Dr. Lee is overseeing. And yes, thank you very much. We'll take any applause we can get. And as we keep implementing health reform in this country through the tremendous efforts of the Secretary and so many others at this department, we want to stress that health reform has an impact on patients with CFS. We have a pre-existing condition insurance plan program that was launched so that people with a pre-existing condition who have not been able to get insurance for 6 months of coverage could potentially get coverage by looking into this option. And we understand that this has helped at least some people with CFS around the country, and we look forward to telling you more about that in future meetings. So these are important advances, but we still have a long way to go, as you know better than anyone. So we are very pleased to have this meeting today, have the leadership of Dr. Marshall, have the expertise of this great committee, and then have this very important meeting today where we focus on childhood CFS, hear from all of you, and then advocacy organizations, make sure that these hearings are transparent, so we can improve the dialogue and see if we can keep making advances in this critical area. So with this, let me just stop and see if we have a couple minutes for questions or comments from the committee. I always stun people into silence, you know, so.
I'd just like to say that the ad hoc working committee really is important, and I know that the work is going forward, and it's important that it does go forward to coordinate the resources. And I'm encouraged in what you said about the progress that's been made, and I know there's still a long way to go.
Thank you very much. We'll keep updating you, and we continue to promote that cross-department integration, which is so critical here. Any other comments or questions? If not, let me go around the room and just thank each and every one of you on the committee for being part of this very important meeting, and look forward to the outcomes here, continued interaction with your new chair. And again, I want to thank Dr. Lee and Ms. Bond for putting so many hours into making each meeting better and trying to address this critical condition as a united group on behalf of the whole country. So thank you very, very much. Thank you.
I want to add my thanks to Dr. Coe. I think many times we don't realize the commitment, even the few, relatively few minutes he's able to spend with us represents a great commitment. I was told that the number of meetings with which he deals are in the dozens per day. And as someone who deals with a couple per day and whines about it a lot, I think it gives me an even better perspective. I want to take just a moment to let everyone know what I see as the importance of this committee and where I see this committee going in its efforts. Some critics might suggest that I'm not really a good person to lead this because I don't do active CSF research at this moment. I've done some in the past. I've cared for patients in the past. In Mississippi, chronic fatigue syndrome is not well appreciated, unfortunately, and there are no physicians who identify themselves as expert in the care of chronic fatigue syndrome in the state of Mississippi, of which I'm aware. And I say that based on the fact that I get regular calls from people asking if there's anyone in Mississippi who can care for them. But we are working extensively trying to get more and more of the primary care physicians, pediatricians, as well as family medicine and internal medicine interested in caring for patients who have complex illnesses such as this. Biomedical research is moving along, and I have done this for about the last 35 years. And some of the things that years ago we all dreamed about are coming to pass. The word translational, when we put it with research now, means that we want to take principles that we learn at the bench and take them to the bedside. A person that I know and respect suggested the word reverse translational, which is going from the bedside back to the bench. And there are those of us who love to do that. We go from the bench to the bedside. We think about research principles. We go from the bedside to the bench. We think about our patients. And interestingly enough, there are three areas in medicine that are sort of coming around. Some of them are nouveau old. They've been around and now they're back again. And some of them really are new, and they've been given names, and they're names that you will hear, and there's certain relationships, and I believe they bear very strong importance to this illness. The first is that area, that old idea of holistic medicine. Too many times, well-trained, there's an arrogance in Western medicine, unfortunately, that says if we can't give a pill or do a procedure, it's not real, number one. Number two, if it is real, it's the patient's problem, not the doctor's. The holistic approach to care says that a person has a body, a person has a mind, and a person has a spirit. Some people might call that a soul. And that you must minister to all three of those to properly care for a patient. That is a Hippocratic principle. I was taught that in the early 80s when I went to medical school. I continue to try to teach that to my trainees. And while we espouse it, unfortunately, sometimes we talk the talk and we don't walk the walk. The next area is integrative medicine, and it's something that many people turn to again because it uses the argument that any evidence-based approach to care, whether it's classical Western medicine or whether it might be alternative or complementary procedures, can be used for the ultimate good care of the patient. And then perhaps the newest one, and for us scientists the sexiest one, is this area called personalized medicine. And personalized medicine makes the argument that by a genetic analysis, that you and I are unique enough and that we can learn profiles of specific genes that will allow clinicians to select the proper and most effective therapy for the individual patient. Yet all three of these are aimed at improving diagnosis and treatment, particularly of complex illness. Not many people seem to think that we need a whole lot of extensive research in medicine and how to take care of a simple middle ear infection in an infant. I might argue that point, but I think most people would suggest that's not a complex illness. On the other hand, illnesses such as ME/CFS certainly have tremendous complexity. And while these terms are fairly recently used, they're well-appreciated concept in medicine that we must address. Most diseases are actually syndromes. We're coming to understand that. We're coming to understand that a similar group of signs and symptoms can be caused by a variety of different factors that require distinct therapies. Asthma is a great example. Hypertension is another. Diabetes is another. Cancer is perhaps, to me, the best example I can think of because I'm old enough to remember when people thought there were about 3 or 4 different kinds of cancer. Go to any academic oncology center now, and there are 300 or 400 different kinds of cancers if you drill down to some of the subgroups of which they speak, and their clinical protocols aimed at very, very specific therapies. We also know that not all patients have the same symptoms, even though they have the same illness. That's called the heterogeneity of disease. And we're beginning to understand that in diseases that we have thought we knew how to care for many years. Hypertension, asthma, cancer being good examples of that. And then finally, we all know that different patients respond differently to different treatments. There's a lot of the word different in there, having to do with the recognition of the unique nature of each individual human being. ME/CFS is a complex illness that has similar symptoms in many patients, but still has a spectrum of illness in severity, in accompanying comorbidities, and in responses to therapy. This is a fundamental reason for the lack of accepted diagnostic criteria and effective therapy that currently exists for patients with this illness. Combining this with the historically and sometimes current lack of understanding among clinicians, researchers, payers, and the public, ME/CFS patients are still waiting, still suffering, still asking for help. Ultimately, the most effective approach to ME/CFS will involve addressing the whole patient, body, mind, and spirit, using any and all evidence-based approaches with understanding that individual approaches must be paramount for caring for patients with this illness. As the newly appointed chair of CFSAC, I pledge to you on behalf of my colleagues that we will continue to advise the Secretary based upon these principles of scientific evidence, clinical wisdom, and moral compassion. And with that,